This time of year can be tough if you suffer from seasonal allergies.
Yeah, that's right. And of course, well, with the virus, still circulating in some parts, how do you know which is which?
Right.
Right? So we're getting some answers from Dr. Benjamin Grin. He is at Kansas City University. Dr. Grin, welcome in. Good to see you.
Thank you so much for having me.
So what time of year typically do people start experiencing seasonal allergies?
So seasonal allergies, right, are the body's response to an allergen in the environment. And so seasonal allergies typically happen when plants pollinate, which happens in the spring. We also sometimes see seasonal allergies in the fall in response to an allergen that's called ragweed. Some people have allergies year round, and that's related to allergens that are around all year, like mold, pollen, and pet dander.
So are allergies just annoying for the most part, or can they present more serious health problems for us?
It's a great question. So for most folks, allergens are just an annoyance, and for some people, a really serious annoyance. I think probably the most serious manifestation of allergies is in folks that also have asthma, because allergies can trigger an asthma attack.
So we have asked this question before, and I think it's a good one to ask you again, doctor, and that is, in the age of the virus here, how can we tell the difference between allergies and COVID-19?
You know, this is so hard. So the typical symptoms of seasonal allergies are like itchy, watery eyes, nasal congestion, sneezing. COVID-19 can present in a lot of different ways. It can present like a common cold, so with a cough, with nasal congestion, with a sore throat, but it can also present with more serious symptoms like fevers and shortness of breath. And, I've seen patients in clinic that thought they were having allergy symptoms, and we did a COVID test and it turned out positive. So really, if you're not able to tell the difference in the symptoms, or if you're worried, I would recommend doing a test.
And especially if your COVID symptoms are mild.
That's the hard thing, is because in a lot of people, particularly in people who are vaccinated, COVID is presenting with really mild symptoms that can look like a common cold or allergies. And the problem is that the symptoms may be mild for you, but if you have COVID, you could pass it along to someone who's unvaccinated or someone who has a weak immune system, and they could get really sick from COVID.
Right.
All right, let's talk about some of the best remedies for seasonal allergies. First off, just tell us what you think are the best, remedies for that.
I'm listening closely.
Yeah, I got a follow-up for you.
So, I think the first thing is to try to avoid allergens, and it's hard, right? But, you can always watch the pollen counts, and probably watching on Fox 4 will tell you what the pollen counts are. And if it's a day with a high pollen count, trying to stay indoors, keeping your windows closed in your house, not driving with the windows down. You can have a HEPA filter at home to try to filter out allergens. For some folks, the allergens are just unavoidable, and there are medications that can help with allergy symptoms. So one are antihistamines, and so medications like Benadryl or like Claritin, those can often be helpful in allergy sufferers. There are also nasal sprays that can help. So the most common one that folks use is one that's called Flonase, and that helps reduce the inflammation in the nasal passages.
That helps me.
Yeah, it does. It helps me a lot too. So, I mentioned that I have allergies year round, and I'm affected by different ones, like pollination affects me, tree, grass, and then also in the wintertime, like mold. And what was the other one that you talked about in the wintertime? Also, what was another?
Ragweeds in the fall.
Yeah, ragweed. Do the medications and the remedies, do they cover all of those types of pollens and mold and, all seasonal allergies?
So, they help. The problem with the medications is that they're sort of covering up the problem, and, they are reacting to your immune system, which is already reacting to the allergens. So the best thing to do is to try to figure out what the allergens are that are triggering you and avoid those allergens. If it's mold in your home, then you may need to look into having that taken care of. For some folks that have really refractory allergy symptoms that are hard to manage, there are specialists that are called allergy immunologists that can do allergy testing and help you figure out what allergens are most triggering you and if there are special treatments that can help manage your allergies.
All right. You're a good person to talk to when everything is starting to bloom right about now. So, Dr. Grin, good to see you, and thanks so much for your time today.
Thanks so much for having me. I appreciate it.
All right, from Kansas City University.